Next, Mr. President, we have Senator Shaheen will join us to discuss 3 healthcare innovations in her state of New Hampshire. My colleague will share with us success of the Center for Informed Choice, the medical home pilot, and the community partnership Improve Public Health. I yield time to Senator Shaheen.
Mr. President.
Senator from New Hampshire.
Thank you very much, Senator Begich. I'm pleased to once again join my freshman Democratic colleagues to make the case for health care reform. And I want to recognize and thank Senator Begich for his leadership in coordinating this morning's remarks. Today, as you've heard, I'd like to discuss 3 exciting initiatives in New Hampshire that are transforming our health care system. These innovative ideas are shaping this debate and are changing the way we think about health care. They're revolutionizing how we deliver necessary health care services, and they're transforming our payment mechanisms. Most importantly, these initiatives go to the heart of this debate. They focus on the needs of patients, they make the system more efficient, and they use our dollars more wisely. The Center for Informed Choice at the Dartmouth Institute for Health Policy and Clinical Practice is dedicated to one simple idea: that patients deserve to be equal partners in making choices about their health care. We know that when patients and their families have good information about procedures, treatments, and therapies, they make good decisions. The researchers at Dartmouth have found that 40% of the time, patients who are fully involved in decision-making process during the course of their medical care choose the less invasive and lower-cost medical procedures. 40% of the time, patients choose the less invasive, lower-cost procedures. More important, their research shows that these patients have better clinical outcomes and higher rates of satisfaction as the result of their treatment. And the providers at Dartmouth put this research into practice. They recognize that it can be hard to decide whether to have surgery, to have a test, or to continue with the treatment. And so they offer patients a variety of resources to help. Patients can talk to a counselor. They can do research in the library or talk to medical professionals. They can find out all their treatment options. They can learn what other people have done and fully understand recovery time and the impact to their quality of life. And they can do all of this online. Mr. President, I've been to the center, and it is very impressive what they do. And soon, this information is going to be available to the public online. Armed with information, these patients become empowered and equal partners in their health care. This is the direction that health care reform must take. Now, another exciting initiative in New Hampshire is our medical home pilot program, which has close to 40,000 patients involved. The medical home is changing the way health care is delivered in New Hampshire. You see, a medical home is about collaboration. It's about a team of health professionals who are working together to provide individualized care for each patient. And in New Hampshire, our medical home pilot has integrated the use of electronic medical records that import hospital, radiology, and laboratory tests directly into the patient's record. And New Hampshire's medical home model offers 2 important services to patients, including same-day scheduling and secure email communications with their doctors. Unquestionably, the pilot is changing the way health care is delivered in New Hampshire. Now, my third initiative that I want to talk about deals with changes that are happening at the local level to improve health in New Hampshire. In the western part of New Hampshire is a small city called Keene, and Keene has set its goal on becoming the healthiest community in America by 2020. So for all my freshman colleagues, you have to share this with the cities in your states and let them know that we plan to be first in Keene, New Hampshire. The citizens of Keene took a look at the data, and they found out that our state's leading cause of death is heart disease related to tobacco use, poor diet, and physical inactivity. The folks in Keene realized that we spend a disproportionately high amount of money on our medical costs instead of focusing on prevention and wellness. So the citizens of Keene took action. Led by a local hospital, Keene established a coalition of partners from all sectors of the community, including education, private business, nonprofit organizations, and municipal and state government. This coalition, which is called Keene Vision 2020, has made it a priority to engage citizens in healthy lifestyles. They've sponsored educational briefings, screenings, health clinics, health fairs, and Keene Vision 2020 promotes the local farmers market, and it's established a local walking group. All of this is done with one goal in mind: to be healthy. I have no doubt that Keene will be a healthier community in 2020, and I have no doubt that the preventive measures in which citizens have become engaged will lower our health care costs well into the future. We should all applaud and encourage this sort of community-wide commitment to prevention and wellness and to public health. Mr. President, this is an exciting time. Congress is closer than ever before to passing comprehensive health reform. Time and time again, we've heard that we can't continue on the trajectory we're on. But, Mr. President, I'm pleased to point out these exciting initiatives underway in New Hampshire that demonstrate that we can improve the quality of care and lower our health care costs. Thank you very much. I yield back to Senator Begich.